Hey everyone, Dr. Fiona Gray here, sexologist and men's health specialist. Today, we're tackling a topic that generates millions of searches online and billions of dollars in questionable products: penile enlargement. I'm going to give you the honest truth about what works, what doesn't, and what could actually harm you. Stay with me because by the end of this video, you'll know exactly what's real and what's just marketing hype. So let me be direct. As a urologist who's been practicing for over 15 years, I'm familiar with both the technical and psychological aspects of the desire many men have for a larger penis. This is a real concern for a lot of guys, and I want to address it honestly and scientifically, not with empty promises or dangerous misinformation. Before we dive in, if you're getting value from this content, please subscribe to my channel. I create evidence-based videos on men's health topics that doctors often don't have time to fully explain in appointments. All right, let's get into it. First, we need to understand the anatomy, because this will explain why penile enlargement is so much more complicated than, say, breast augmentation. The penis is an organ with multiple critical functions: reproduction, pleasure, urination, and for many men, their sense of male identity is directly connected to its size and ability to become erect. You can't just slap an implant in there and call it a day. Let me explain what we're dealing with. The penis contains the corpora cavernosa, which are two cylindrical chambers that run the length of the penis. These fill with blood during erection and are responsible for rigidity. The urethra, which you urinate through, runs through the corpus spongiosum, another chamber that also fills with blood but is less important for stability. Around all of this is the tunica albuginea, a tough fibrous sheath, and buccal fascia. The penis is also connected to the pubic bone by the suspensory ligament, which provides stability during intercourse. Here's the problem. Making a penis larger literally means you have to do something to the corpora, the urethra, the nerves, and the blood supply. You have to elongate all of this somehow while maintaining function. For girth, okay, that's theoretically easier. You can do some bulking under the skin. But for length, I have to tell you the truth. Genuine elongation is impossible with current medical technology. We simply don't have techniques to make organs bigger while maintaining their function. And here's something important. The actual urological guidelines, the official medical standards that urologists follow, neither support penile elongation techniques nor injections for girth enhancement for purely cosmetic reasons. The efficacy of such procedures is not backed up by sufficient evidence, and safety is a huge concern. This means penile enlargement is regarded as purely experimental by the medical community. That should tell you something right there. Now, let me break down the options that exist, and I want to be clear about what each one can and cannot do. Option number 1, non-surgical stretching devices. The concept of stretching tissue is very old and has been used for thousands of years in indigenous populations around the world. You've probably seen images of people with stretched earlobes or neck rings. The principle is that consistent, prolonged tension can cause tissue to stretch over time. Could the same principle apply to the penis? Possibly. I actually do prescribe stretching devices for some of my patients with Peyronie's disease to prevent the inevitable shrinking that happens with that condition. But even for medical purposes, there's no truly reliable evidence. What limited research exists suggests that these devices might result in increases in length, but we're talking very moderate amounts, like 0.4 to 0.7 inches, after months of consistent daily use. Let me be honest with you. If you're looking for penile enlargement, you're probably not looking for a subtle change of half an inch that takes 6 months of wearing an uncomfortable device for hours every day. You're looking for dramatic results. Stretching devices will not deliver dramatic results. Option number 2, weight loss. This one actually works, but not in the way you might think. If you're overweight, your penis is going to appear smaller because the subcutaneous fat in your pubic area increasingly covers parts of the penile shaft. So losing weight is a strategy to reveal what's called a buried penis. The penis itself isn't getting bigger, you're just uncovering what was always there. I've had patients lose 30, 40, 50 pounds and tell me they feel like they gained an inch or more. They didn't gain anything. They just revealed it. If you're carrying extra weight, this is the safest and most effective penile enlargement technique available, and it comes with a ton of other health benefits too. Lose the weight, reveal the penis. It's that simple. Option number 3, surgery. This is where things get risky. When it comes to lengthening, as I said, there's no true lengthening possible. So what surgeons do is work around the problem. Remember that suspensory ligament I mentioned that connects the penis to the pubic bone? That ligament provides stabilization during sexual activity. Some surgeons cut this ligament to mobilize the penis so it protrudes more outside the body, thus appearing longer without actually being longer. It's essentially a fake enlargement. You're not making the penis bigger, you're just letting more of it hang outside the body. And this comes at a significant price. Because you've cut the stabilization structure, erections are no longer stable. The erect penis will hang downward instead of pointing up or straight out. As a result, intercourse can become difficult or even impossible because of the lack of stability. You might gain half an inch in flaccid length, but lose the ability to have functional sex. That's a terrible trade-off. For girth enhancement, there are several techniques. Fat can be taken from your belly through liposuction and transferred to the penile shaft. Sounds good in theory, right? The problem is that a significant amount of this fat will be absorbed by your body over time. So after several months, the girth becomes smaller again. Surgeons have to account for this and over-inject, which can lead to lumpy, irregular results. There are also silicone implant procedures, where medical-grade silicone is placed under the skin to enhance girth. Some practitioners inject hyaluronic acid, the same stuff used in lip fillers, into the penile fascia. And there are grafting techniques where the tunica albuginea is actually cut open and patches of graft material are sewn in to increase girth. All of these techniques sound scientific, but here's what I need you to understand. These procedures carry serious risks. We're talking about infections that can permanently damage the penis, gross deformities, asymmetries where one side is bigger than the other, shrinking of the penis from scar tissue, loss of sensation, loss of erectile function, and in the worst cases, you can lose your penis or parts of it entirely. I'm not being dramatic here. I've seen patients who went to unqualified practitioners for these procedures and ended up with penises that were disfigured, non-functional, and required extensive reconstructive surgery. Some damage cannot be repaired. You can end up with a penis that looks so abnormal you're afraid to show it to anyone, and that doesn't work properly for sex or even urination. So what do I think as a professional? If it ain't broke, don't fix it. This is a rule I live by in medicine. Most men who want to enlarge their penis are actually normal in size. The average erect penis is about 5 to 5.5 inches in length. If you're in that range, you're average. If you're above 4 inches erect, you can have perfectly functional, satisfying sex. The desire for a bigger penis often comes from unrealistic expectations, set by pornography, locker room comparisons, or insecurity rather than actual functional problems. Any surgical procedure is linked to unnecessary risks when you're starting with a healthy, normal organ. In summary, healthy, normal-sized men risk permanent disfigurement of their penis if anything goes wrong. Is half an inch worth that risk? I don't think so. Now let me address the elephant in the room. Penile enhancement pills. These products flood the internet with promises of dramatic growth, increased performance, rock-hard erections. Let me be crystal clear. These pills are totally useless for enlargement. There is no pill that will make your penis bigger. None. Zero. It doesn't exist. Some of these pills contain herbs or supplements that might improve blood flow slightly. which could help with erection quality if you have mild erectile dysfunction. But they will not, I repeat, will not make your penis larger. These companies are preying on men's insecurities and making fortunes selling false hope. Here's my advice, as both a urologist and someone who cares about men's well-being. Save your money. Instead of spending hundreds of dollars on useless pills or risky procedures, invest in things that will actually improve your sex life and confidence. Work on your physical fitness. Exercise improves cardiovascular health, which improves erectile function. It boosts testosterone naturally. It increases your stamina and confidence. Work on your sexual skills. Learn about female anatomy and pleasure. Most women don't orgasm from penetration alone anyway. Oral skills, manual skills, emotional connection, communication, these matter far more than penis size. Become a generous, attentive lover who cares about your partner's pleasure, and size becomes almost irrelevant. Address any actual erectile dysfunction you might have. If you're having trouble getting or maintaining erections, see a urologist. This is often treatable with medication, lifestyle changes, or other interventions. A fully functional 5-inch penis is infinitely better than a 6-inch penis that doesn't work properly. Work on your confidence and mental health. If your insecurity about penis size is affecting your relationships or quality of life, consider talking to a therapist who specializes in sexual health. Body dysmorphia is real, and sometimes what you think is a physical problem is actually a psychological one that therapy can help with. Improve your overall health. Maintain a healthy weight. Don't smoke. Limit alcohol. Manage stress. Get good sleep. All of these things improve sexual function and confidence more than an extra half-inch ever could. Now, I'll say this. There is one exception to everything I've said. If your goal is to become an adult film performer, then yes, penis size probably does matter for that specific career. But for the 99.9% of men who aren't pursuing that path, your penis size is almost certainly fine. Let me share something I tell my patients. The best sex organ you have is your brain. Your attitude, your confidence, your emotional connection with your partner, your willingness to communicate and learn, these determine sexual satisfaction far more than measurements. I've counseled countless couples over the years, and I can tell you that penis size rarely comes up as an actual problem in satisfying sexual relationships. What does come up? Communication problems, mismatched libidos, erectile dysfunction, premature ejaculation, lack of emotional intimacy, stress, health problems. These are the real issues affecting people's sex lives, and these are all addressable without surgery or snake oil pills. So here's my final recommendation. If you're genuinely concerned about your penis size, start by getting an honest assessment. Measure yourself properly when fully erect, from the pubic bone to the tip, not from underneath. Compare that to actual average sizes, not porn. If you're within the normal range and you're still deeply distressed, talk to a mental health professional about body dysmorphia. If you're overweight, lose the weight and reveal what you've got. If you have erectile dysfunction, get it treated properly. If you want to improve your sex life, invest in education, communication skills, and overall health. These will give you far better returns than any enlargement procedure. And if after all of this, you still want surgery, please do your research. Find a board-certified urologist with extensive experience in these procedures. Get multiple opinions. Understand all the risks. Have realistic expectations. And be prepared for the possibility of complications that could leave you worse off than when you started. The bottom line is this. You most likely don't need penile enlargement. What you probably need is better information, improved confidence, and maybe some lifestyle changes. Your penis is probably just fine. Focus on being healthy, being a good partner, and being confident in who you are. That's what will actually improve your sex life. Thanks for watching. If this video helped you, please like and subscribe. Check out my other videos on erectile dysfunction, testosterone, and men's sexual health. And remember, if you have real concerns about your sexual function, see a urologist. We're here to help with actual medical problems, not insecurities created by unrealistic standards. Take care of yourselves, guys. I'll see you in the next video.